Now that since you have worked as a professional in this field,
Yeah.
I'd like to ask you how it is like in Sri Lanka, in the Sri Lankan community. Now, we hear about a lot of disorders among children in the Sri
Yeah.
Lankan community, but I personally have not heard a lot of significance being given to children with speech delays. So, which is also your niche, right?
Yeah.
So, as a professional, how have you perceived the situation,
Yeah.
and what sort of, what sort of input would you like to give to create more awareness in this regard?
Yes, yes, Lahini. So it is my specialty to treat children and also adults with speech issues. But when you talk about children, I mean, I can't stress enough on the importance of what we call early intervention and early identification, because I mainly treat children at this point. So there are children who come once they have actually reached the almost finishing the point of development. Of course, we still treat them, but in terms of outcomes and in terms of speaking scientifically, the outcomes that we could get is minimal compared to if the child came earlier on. So speech delay is very, very prevalent and it's treatable. So many a times what happens is, because of culture, because of what other people say who are not medical professionals, people delay coming to a professional to get help for children having speech delays. So this could result in permanent effects in a child's life. So if you think about speech, communication, language, those skills are one of the primary and one of the fundamental skills a child needs to be able to go to school, to be able to make friends, to be able to communicate, basically to be able to be functional in society. And if a child is deprived of these services, this child can end up having a disability, and it could be a significant disability. So many a times the identification process happens through the pediatrician, if not a general GP, or even sometimes the preschool teachers, the parents come to us identifying it themselves. So sometimes raising awareness at multiple layers is needed so that these children get the proper intervention that they need at a timely interval in their life. So when I say timely interval, so 0 to 5 is where the brain development happens at a peak. Then it tends to plateau. Right? So while it's happening at a peak like this, that is the point where we come in and we start giving therapies in order to stimulate and boost this language and speech development. So if that is delayed, and if they come later on, say after 5 or after 8, this process is going to be much harder for the parents and also for us sometimes. So what we do at this point is, as medical professionals and as other professionals have got organized, and they are doing what we call screening examinations. So if any child in a nursery or in a daycare is they suspect the child to be having a delay, they are identified early and then sent on for intervention. So that if that is being done, the results we can improve on the results. What we do as professionals is we try to get this child as much as they need to be able to come to the level where they're supposed to be. So that's what we do from our profession.